to see, we just need to see, we need to select multiple, um, what we are saying, we need to select multiple. Okay, because sometimes you need to go to every patient, and then you need to decide, okay, which one gonna take um, help. Okay, why we think A is correct? There is number of comments with A, B, and D. Yes, good one, Alfred. Good one. Okay, a patient with COPD with oxygen. So, what is our baseline oxygen for COPD? What is our baseline oxygen level for COPD? Yeah. What we usually aim for? 88, 92. Yeah, depending upon from how long they are having. Yeah, so 88 to 92 is also correct, also correct. But because it's breathing related issues, okay, so according to ABC, we gonna make sure the patient is comfort, patient is not experiencing anything. So even not Sani, not in 80s. Okay, so if patient is 81, that's too much. Okay, that's too low. So we wanna make sure like what level of um, COPD he's experiencing, and we will try to intervene with different positions and oxygen and maybe bronchodilators also. Okay, okay, 89 because we are working here. Yeah, yeah, we are working here on ABC. So definitely airway is our priority. So we're gonna see this person also. Do we need to see B? A post op thyroidectomy patients reporting tingling around the mouth. He is not showing. Yeah. Expected? Yes, B. Yeah. What can happen? Why we have tingling around the mouth after thyroidectomy? Calcium, yes, JJ. Hypocalcemia because parathyroid gland does manage and regulate calcium level. Okay, so even though this is expected, but most of the time, even though like pain is expected, but when in thyroidectomy they can be accidentally damaged, or like remove, like cut. So that's why there will be less parathyroid hormone over there now. So definitely we're gonna see B also. Okay, and what can happen if we have less calcium in body? Hypocalcemia, what it can lead to, guys? If we have less calcium in circulation, what can happen? Dysrhythmia? Yes. Yeah, tingling is damaging the gland. Yes, JJ. A is right. Leslie, yes, definitely A is right. A is correct. B is correct. Okay, because patient is experiencing tingling and after thyroidectomy, and that is the classic sign of damage of parathyroid gland. Okay, and that's why less calcium can lead to cardiac arrhythmia, seizure. So we need to see that one. Okay, or we might need to give the potential supplementation over there. Okay, option C, is C correct? A patient with type 2 diabetes requesting pain medication for foot pain. Do we need to prioritize this patient? C is wrong because this is expected. This is expected, and this is one of the routine thing. Okay, when we are prioritizing, we need to see whether that is a routine or not, or and expected or not. Okay, so we are not gonna worry about this much, this one right now. Okay, so C I'm not gonna worry about right now. I will leave it for later. D. A patient admitted with pneumonia who is anxious and using accessory muscle to breathe. D. Yes. D. Yes, definitely. And again, why D is yes? Because it's ABC and it is showing respiratory distress. So we need to worry about D. Okay. So patient number E. A patient with stable femur fracture requesting repositioning. Is this expected or not? B is because of hypocalcemia. Um, Leslie, because these are SATA questions, so we are just prioritizing this. This is practice, okay? Because in normal questions, you need to prioritize only one patient. The only reason we made SATA question just for our practice, so we can discuss deeply why we need to prioritize that. Option A, even if it is expected, is still ABC. It's still airway. So we need to know, we need to check whether patient is okay or not. Okay. So that's why we selected three patient from this one that we need to see first. And this is just the practice when we have MCQ prioritization question. We don't need to worry that much because this will help us to understand all the tools that we are gonna use to prioritize. Okay. Okay, a patient with a stable femur fracture requesting repositioning. Yeah, do we need to worry? What is this about? What patient is requesting by repositioning himself? When patient is requesting for repositioning, what he wants, what he wants from us. Yes, comfort. Yes, Sunny, definitely comfort. Is comfort a priority? When we are prioritizing um, patient, is comfort priority? No, just atom. Okay, so we are not gonna prioritize this patient. Okay, alrighty. Okay, so correct answer is A, B, and D. Alrighty. So now we have A, B, and D. So from all these, from A, from B, and from D, you are only on shift right now. Which patient you gonna see first? Which patient you gonna go and see first? It is controversial. It is very controversial right now. D, COPD. I will leave D first. Okay, yeah. What about B, guys? If B is tingling, can calcium wait? Hypocalcemia, can that wait? D, then B, then A? Yes, Sunny. Yeah. Okay. The only reason why I will, yeah, the only reason why we will go with D first, because this is the patient that needs something from us. Okay. B, definitely we're gonna give this person calcium, but body have ways to compensate. Okay, body do have ways to compensate, but we will definitely go to B after that. Airway always first. Airway, breathing, circulation. So this one is airway and this one is circulation. B is circulation. Okay, so we will move to airway first. Okay, good one. Let's move to question number 2. So, a nurse is caring for a patient in ED after a bus accident. Please shout out if you are ED nurse. Please hands up. Which patient require immediate prioritization? Select all that apply. A patient with a sucking chest wound, a patient with open tibial fracture bleeding heavily, a patient with scalp laceration and controlled bleeding, a patient who is unconscious and snoring respiration, and a patient with dislocated shoulder and severe pain. ABD, who's from ED, who's working emergency department. Good one, Alfred. Good one, Sani. Yes, Anjali. Nice. Good one. Yeah. Amelda, definitely A and D. Yeah. Nice, nice. Okay. Okay. A patient with sucking chest wound. What is going on there? When we have sucking chest wound, what conditions we are dealing with? What's happening with the patient, guys? DB, nice. Pneumothorax, chest any open pneumothorax. Okay, so that's why it can cause lungs to collapse, severe respiratory distress, and even death. Okay, just open trauma to lung, definitely. Okay, and this is severe breathing. Okay, this need to address. This is severe breathing. You have wound, so there is a problem with breathing, there is a problem with airway, there is a problem with circulation. So you will see all A, B, and C in this patient. Everyone agree with that, that we will see all A, B, and C in this patient? Yes. Yeah. Okay, so we definitely gonna see A. Okay, a patient with open tibial fracture bleeding heavily. What is going on there? What was happening? What we are prioritizing? Circulation? Yes. Okay, C from circulation. And it is bleeding, hypovolemic shock. Yes, volumes loose. Definitely, guys. So this patient also we gonna prioritize. Okay, option number C. This is the patient with only scalp laceration and controlled bleeding. Are we worried about this patient? No, see, no, definitely. And when we say controlled bleeding, that means this patient is already have, yes, just definitely, already has been looked after, okay, or is stable. Yeah. We don't want to assume everything, but C is not priority in this case. Okay, a patient who is unconscious with snoring respiration. What about D, guys? I did see some D. I did some D. Yes, yes. Obstructive breathing. Yeah, traumatic brain injury, narrowed airway. Definitely. Because patient is unconscious. Patient is unconscious over there. So we need to see that patient. Okay. Most of the time in unconscious patient, what can block the airway? What can block the airway in most of the patient? How? Tongue. Yes, Dorian, definitely. This is the most overlooked thing, overlooked, point that we need to see. Okay, please, when you have unconscious patient, especially in ED, make sure you check the tongue. Okay, because it can flap over and it can block the airway. Alrighty. Okay, we will see D because it's A, B, C, it's airway. It's A. A patient with a dislocated shoulder and severe pain. Do we need to worry about patient number E? Is it life threatening? Guys, please keep double tapping. Thank you, everyone. Yes. Okay. I know it is painful. It is very painful, but we don't need to worry about that right now. It's not life threatening, guys. Okay. So now we have three patients. We have patient A with sucking chest wound. We have patient B with open tibial fracture. and we have patient D with unconscious. DABEC. Yeah, everyone agree with Jamie? Because especially in emergency we do have enough staff, and NCLEX is good also. Okay, and this patient is not gonna take a lot of intervention just to prevent the airway, because most of the time it is tongue, so you really need to reposition the patient depending upon what kind of spine precautions they have. Okay, and then we will definitely move to A. Yeah. Hi John. Okay, and this is complex question, because the only reason why I made it so complex, because anything can happen in real life. Okay, usually when you will have prioritization questions you only need to choose one, but now you can see these are very hard, and these will give us idea like, okay, I don't know what I'm gonna do right now. Yeah, so that's why it's important to discuss, it's important to know, it's important to prioritize, like, okay, which one, because we might will able to provide staff to all three at once in emergency, but the thing is that how our critical thinking is working over there right now. Yeah, so we will go like that. If everyone happy with these kind of question, please let me know. I really appreciate, I really need feedback how we are doing. And then it's good rationalizing, good reasoning, you know. Okay, let's move to question number 3. The nurse received the following shift report. Which patient should assessed first? Select all that apply. So this one is also select all that apply, but at the end of the day we are gonna choose first again. How we did that, you know. A patient with heart failure and frothy pink sputum. A patient with atrial fibrillation on warfarin with INR of 1.8. A patient or post-op patient with abdominal distension and absent bowel sounds. The patient who had chest pain relieved after one nitroglycerin tablet, or a patient with blood glucose of 42 and diaphoresis. Okay, Maria. Okay, guys. Yeah, your guess is good. Okay. What about A, guys? What's going in A? When we have heart failure and when we see pink sputum, what it is indicated? Pulmonary edema. Yes, acute pulmonary edema, Nicole. Definitely. So where it stand in ABC, does it affecting airway, breathing, or circulation? Yes, it does affect B, it does affect breathing. Okay, we are working on pink sputum also, actually, because heart failure definitely we are seeing, John, circulation is there, that is definitely by heart rate, but it is compensating breathing first. Okay, and that's why you have frothy sputum. Okay, definitely we're gonna look after A. Okay, because fluid is filling the alveoli over there, and there is not enough oxygen exchange is going on, so it is severe breathing issue. Okay, we need to provide immediate intervention. What about B, guys? What about B? I know INR is 1.8. What is the normal level of INR? What is normal INR? B, yes. Is it life threatening? Let's put it in that way. So 2 to 3 is normal. Is 1.8, just 2 to 3 is normal? Yes, correct. Thank you, guys. Is 1.8 life threatening? Nearly normal, yes. So if we're gonna prioritize the questions, so from this scenario, because otherwise patient is having atrial fibrillation also, so we will bit worry about that one. But when we are doing these scenarios, so from this one we don't need to worry about B right now, because it's not the immediate life threatening emergency, and it can be just adjusted with the dose. Okay, if warfarin is adjusted, it's gonna take some time. Yeah, yeah, just low lazy. And warfarin dose adjusted is gonna take some time to work around also. So definitely this one we don't want to worry about. Okay, what about C, post-op patient with abdominal distension and absent bowel sound? What's going on there? Is C correct? Paralytic ileus, just Dorian, right on the point. Because when we have abdominal distension, and especially with the absent bowel sound, you know, it is indicating bowel obstruction, paralytic ileus. Okay, Anjali B, because 1.8 is, we just done the trial level, we just checked the warfarin level over there. So 2 to 3 is normal. So we don't need to worry about that right now. And there is no life threatening emergency and something we need to give to patient unless it's very low. Okay, we can just adjust the warfarin dose and it can be treated accordingly. It will come to normal. 1.8 is INR, International Normalization Ratio. So that is the one we need to check when we give warfarin to patient. Likewise, we check APPT, prothrombin time, partial prothrombin time in heparin. We check INR in warfarin. Okay, so the post-op patient, definitely paralytic ileus. This person is gonna need immediate assessment. Okay, because it can worse. Normal range is 2 to 3. Okay, so C is correct, guys. C is correct. Okay, D. What about D? A patient who has chest pain relieved after one nitroglycerin tablet. What about D, guys? Is D okay? Yes, D is stable. Yes, D is definitely stable. And we are not, because when we discussed yesterday, especially when, yeah, still monitor. Definitely we are gonna monitor this one. So, what's going on with patient when they are having chest pain and relieved by first dose of nitroglycerin? Is it myocardial infarction? Jamie, for warfarin, you check INR. For heparin, you check APPT. Yes, angina. Okay, so when we are having angina, it's not myocardial infarction. So that's why okay, they, it's not the highest priority. Okay, we still have time to work on that one. Okay, last one. A patient with blood glucose of 42 mg per deciliter diaphoresis. What's going on over there? Why is C highest priority? Right now, we are not saying C highest priority. Right now, we are just selecting which one are highest priority. Okay. C है blockage of intestine, paralytic ileus. Yes. Yeah. Because it can block badly. It can lead to bowel perforation. It can lead to sepsis. It can lead to whole lot of life-threatening complications. Okay. Yeah. Alrighty. E, medical emergency, hypoglycemia. Everyone happy with that? It's only 2.3 mmol, guys. 42 mg. Yeah. So this one is metabolic emergency, and it require immediate administration of glucose. Yeah. Alrighty. So we have now three patient, guys. Which one is first priority? A, C, or E? From these according to NCLEX, which one is most unstable? E needs some emoji first. Yeah, and this is the another thing, because E we can sort out easily. Okay, E we don't need to spend too much time. Um, then B, then C. Maria, we are not worrying about B and D right now because B is okay. So, okay, after E, do you guys want to go to A or C? E, C, A? Yeah, I think so. I will leave C for the last, guys, because it what 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 intervention we can give with C? What intervention we can give with C as a nurse? Just screener, definitely EAC, enema. And is enema is gonna take any effect? Just any, he need actually OT. Okay, he need OT straight away. We need to have a scan, we need to find out what's going on, and then he need, yeah. Okay, not right away, JJ, yeah, but like most of the time I have seen um, blockage in emergency. um, we do give Malaxol, but depending upon, yeah, compository definitely, and large amount of drink, and then we will see like whether that is working or not. Keeping the patient in ward until it's resolved and enough hydrated. Yeah, assessment, walk around, fiber or back to over. Yeah, yeah, yeah. Yes, Sunny, it is gonna take bit of time. So C we will leave at last from these one. We will do EAC. Everyone happy with that? I will do E first because that is easy. Just Jamie, A is chronic. That's why we are leaving. Yeah, that's why we are, because E is acute. E is acute, and we want to sort out that can lead to other complication quickly. Okay, let's move to next question. Question number 4. I think we only gonna do 10 question today. It's good rationalization going on. So nurse is caring for 4 patient which require immediate action. Yeah, that's the one. A patient with sepsis and MAP of 55. A patient post MI with S3 heart sound. A patient with COPD complaining shortness of breath. SpO2 is 92 only. The patient post hip replacement with O2 saturation of 82%, and patient with cast on leg reporting numbness and severe pain. Okay, so let's guess what we are gonna do, and then we can go option by option. I'm gonna have a bit of drink. What about A? What's going on with A, guys? Just Krina, all of those are good. Okay, all of you did it on right on point. Yeah. Okay, A having sepsis, we are having septic shock there. Yeah, and what is normal map? What is normal map, guys? 62, 7200? Yes, 7200 is normal, but we accept 60. Okay, who did say 7200, Ebony? Yeah, good work. Okay, mean arterial pressure. Jemmy, mean arterial pressure. Okay, but I pass in my exam. Okay, all good. So definitely we're gonna see this person also, because it is and when we are having shock, what it is affecting, is it affecting airway, breathing, or circulation? What it is affecting, guys? All circulation most of the time. Yes, circulatory is main. Okay, so we will put bit of C there. Okay, let's move to option B because most of these patients are priority. A patient post MI with new S3 heart sound. What's going on there? We have myocardial infarction and now there is S3 sound. What it is indicating? That's expected. It is expected, but what it is indicating, guys? Heart damage, fluid buildup. Yes, JJ. So when we have S3 sound, especially after post MI, it is classical sign of worsening heart failure. Okay, that means we are heading for heart failure and fluid is building up over there, fluid volume overload. Okay, so when we have fluid volume overload, what it is indicating, A, B or C? And guys, you know heart failure is also gonna cause same thing, cardiac tamponade. C, yes, circulation. Okay, so we see circulation in this one also. Yes, Leslie, ventricle can't pump effectively in that case. So that's why we see S3 in there. Okay, and it is a severe circulatory problem, and we need to act fast because we are having heart failure that is, going up and up, not resolving. Okay, let's do C, guys. A patient with COPD complaining of shortness of breath but SpO2 92. What about C? No. Yes. Okay. C is no. Anjali, I will explain B. Expected but B. Yeah. It is expected, and it is breathing also. So we will, yeah, yeah. So it is acceptable, and patient is having COPD. Most common symptom of COPD is shortness of breath, but SPO is 92, so it is acceptable. Okay, so we will worry about this one, but at last. Okay, so yeah, it is chronic also. Assessment chronic but stable. Okay, and I'm gonna put B here because it is affecting breathing, so later on we can discuss. A patient post hip replacement with oxygen saturation of 82%. What about D, guys? Yes, D is definitely yes. Yeah, so what happening with D? What is happening with D is post hip replacement, and we have risk of PE. Yes, Candy RN, definitely we are having PE over there. Okay, and especially is prominent in um, like hip replacement. Yeah, so what we need to administer over there, what we gonna do with patient, what we gonna do with patient? Oxygen, respiratory failure risk. What intervention we are going to do with this patient from our side? Oxygen, definitely yes. Okay, because patient is having higher hypoxia and it is doing B also, so let's put B for breathing. Yeah. Okay, a patient with a cast on leg reporting numbness and severe pain. What about E, guys? What's going on with the patient? Compartment syndrome, and is compartment syndrome priority? Yes, compartment syndrome, definitely. What can happen if we will not intervene immediately? What can happen? Circulation loss, loss of tissues, loss of circulation, loss of limb, loss of nerves. Yes. And where it's gonna stand in ABC is gonna stand in C, circulation. Yes. Okay, so now let's see according to our rules. Um, who we gonna see first? It can be any. You guys can decide. These all four are important. We don't have to choose one. We really don't have to choose one. But if we have to suppose if we got all these patients all together, who we gonna see first? D. Yes, definitely D, because it is most important and we can actually work around that easily. Okay, we need to give oxygen as soon as possible to this patient. Yeah. D, E, A, B. D, E, A. Why we don't need to go to A after D? And I'm just randomly asking why we don't need to go to A. What you guys can do with B? MAP is mean arterial pressure. Anybody want to explain, Anjali, what is MAP? Anyone, or shall I do? Guys, why we? Yeah. Yes. What else? Average pressure within the vessels. Yeah. When you travel, you need it. Okay, that's the one. Yeah. Yes, that's the one, Kindra. The average between systolic and diastolic. Okay, this is the simple definition. Yeah. Okay, guys, what we gonna do with? Okay, we got the D. D is our priority. What else we are gonna do? Do we need which one? The next one we can intervene as a nurse. We can sort out, because do you think B we can sort out without professional help or prescriber help? Which one we can sort out easily? This is very complicated because we have now four. Yeah, we don't remove, we just report to doctor. So E1 is gonna go to doctor and easily sorted. Yeah. Position, I it can help, but I don't think so, because arterial pressure is always gonna be high, and they need to actually cut off the cast. Okay, just to see. D, A, E, B, C. D, A, B, E, C. Yes, Ebony, definitely, that's the correct way. So we will go to D first, and then we will go to A and B. Okay, and then E. Yeah. Okay, let's move to next one. I know this is the hardest um, one we are doing right now, but this is gonna improve our critical thinking. Okay, this is gonna improve everything. What we gonna look into the patient, and we are studying med surg also. We are studying everything in this one. Okay, a nurse is caring for a group of patient. Which situation should the nurse prioritize first? What we are gonna do here? A patient with pancreatitis reporting severe unrelieved abdominal pain, and a patient with GI bleed with BP 8650, a patient scheduled for dialysis with serum potassium of 6.2 mmol per liter, a patient with new slurred speech or facial drop, and a patient with chronic back pain require medication. what we are gonna see in that one, guys. Thank you, Ash. Thank you for following. Yeah, shall we go one by one? Um, Sani, are you talking about the last one or this one? Thank you, Leslie. Leslie, these all will be posted on YouTube. So please subscribe the YouTube, and you guys can have. I'm just gonna, Sani, if you were asking about last question, what nurse can do in sepsis one. Can you guys please tell me what nurse can do in sepsis one? Sorry, I know we will discuss that one. What is the role of nurse in sepsis? There was a comment. We need to work on that. Jackie fluids for sepsis? Definitely. What else we can do? Yeah, fluids, IV lines, oxygen, yeah, vancomycin, yes. Okay, so most important in sepsis is fluid resuscitation. Okay, so that's what fluid resuscitation, oxygen to reduce the overload on um, heart. So that's why it is very important. It is very important. And when we are prioritizing, because we are prioritizing according to our understanding, so we need to know what we can do in that situation. Okay, if something is like E, you just need to report to the doctor at that time. Okay, you just need to report to doctor, this is happening, I see signs of compartment syndrome, we have to do it. Yeah. Okay, let's do this one. You guys already given the answer, so let's move to option by options. Okay, so what about option A, guys? Is a priority a patient with pancreatitis reporting severe unrelieved abdominal pain? Is it life threatening? That's what we need to know. Is it life threatening? That's expected. Yes, guys, that's expected. Okay, it can be sign of worsening condition, but it is not immediate threat. Okay, and this is something how we can work around pancreatitis. We can give antibiotic, we can, if patient need to go for surgery, we can prepare, but those things are gonna take time. Okay, those things are not gonna be quick one. Alrighty, they can wait. Okay, so we really not gonna worry about A right now. Let's move to patient B, a patient with GI bleed with BP 8650. This one is going away. We need to intervene as soon as possible. Hemorrhage happening, and that is leading to hypovolemic shock. Yeah, lack of perfusion, shock risk, definitely. Okay, so we need to intervene in this one, and it does affect the circulation, so it is on the C. Yeah, yeah, it can, yeah, replace fluid volume, definitely, definitely, and put patient nil by mouth on that time, nothing irritant. Okay, a patient scheduled for dialysis with serum potassium of 6.2 is C priority. What is normal? Juju, which one? Which question from option, these option or other one? What is normal level of potassium, guys? 3.55. Yes, so 6.2 is quite high. What can happen if somebody is having 6.2? What we gonna see? Arrhythmias or dysrhythmias? Arrhythmias, yes, Ivoni, definitely. Okay, so we need to notify the provider as soon as possible. Okay, yeah, what we can give to patient if somebody is having hyperkalemia. I know we can't prescribe, but what medication they can give in too much hyperkalemia. Furosemide, Localma, diuretic, loop diuretic. What else? Which medication maintain um, calcium gluconate? That's what I was looking for. One, yes, Ivani, calcium gluconate. Others are correct also, but like definitely calcium is main one. If that's the first choice, if it is very severe. Okay, so we're gonna definitely see this one. So is this falling under A, B, or C? Is it airway, breathing, or circulation? C, circulation. Definitely circulation. So we're gonna, this does just help us to see which one we are gonna prioritize later on. Okay, a patient with new slurred speech and facial drop. What's going on with patient number D? What are the signs of? He should be right. He has severe pain. Anjali, that's expected in pancreatitis. Meek A, B, and C is airway, breathing, or circulation. Okay. Time is brain. D is number one. Yes, Kindra. Definitely, time is brain. Okay. And especially if we will not start it as soon as possible in stroke, then it can cause long term, disability. So it is neurological emergency. It is neurological emergency, guys. So time is brain. Alrighty. So we're gonna look after D also. Yeah, CT scan to see how long. And sometimes people comes with like multiple hematomas in brain affecting the different um, areas. Yeah, CT thrombolytics, altiplase. Everyone using altiplase or any other one? They have started now instant one also. And how long we need? What is the time limit to do altiplase? Thank you, Reet. 1 hour. What is the maximum time limit? 3545. Yeah. Yeah, 4 hour at least, guys. 4 hour at least. Okay. Yeah, up to 4. Sweet. A patient with chronic back pain requesting medication. Is he worrisome or we are okay? We can ask him like, can we come later? Yes, least worry. Yes, definitely not critical. Okay. So we have 3 patients right now. We have B, we have C, and we have D. And we already discussed the interventions, what we can do in D. Definitely, if they are giving us altiplase, yeah, then we know. In C, if we are seriously seeing lot of arrhythmias, and then prescriber has prescribed the calcium gluconate something, then we can give that one. And definitely A is having GI bleed. Okay, just treat acute then chronic, definitely. Okay. Okay, what you guys want to choose? D, B, C? Jaskindra, everyone happy with DBC or BDC? DBC, yeah. Yes, we need to, because D is important. D is important. DNC, yeah. And the only thing is like with D is I will choose B over D. If anyone can answer, please. I will choose B as a first priority, and then I will go to D, and then I will go to C. Hemorrhage also, yes, Sunny, definitely. D is gonna take lot of time. D is gonna go for CT scan. D is gonna go for like all the assessment first, and then LTP is gonna start. Okay, then they're gonna decide what kind of medication they're gonna give to patient. Okay, so but B is priority. B is hemorrhage, hypovolemic shock. B can go into cardiac arrest. B can lose lot of fluid. So this is the one thing that we need to see, that we can easily intervene. And yes, just headaches, hemorrhage we need to sort out first. So sorry guys, but are you happy with B, D, and then C? Because the reason why I'm saying C, because this patient is already scheduled for dialysis. Yeah, this patient is already scheduled for dialysis. So that's the reason I'm choosing C at last. Because that's why they are gonna, he will be sorted. Once he have dialysis, he's gonna be sorted. Okay. Yes, Kindra, definitely. Okay, so that's why we are gonna go to B first, then we can do D first, and then we can go to C. Okay, hopefully we don't have all these patients together. Pray. So but yeah, but we need to do that. Yeah. And I really like the MCQ question in prioritization, because then you have to choose only one answer in there, and that's very specification. Okay, what I'm gonna, you just need to create a tick box whether patient is stable, unstable, whether ABC, whether Maslow, physical or psychological or safety. Yeah, addicts definitely. But when somebody is already on dialysis, they are expected, they can expect the high serum potassium level and other levels. So that's why. Okay, and especially in this question they didn't told us like when he is going to go for dialysis. If they will say like in next day, definitely we will look into 6.2 today. Okay, but now just think like this patient is going for dialysis. This is the one another way to look after the question. Okay guys, let's move to question number 6. So a nurse is caring for 4 patients. Which patient should be elevated? Uh, yes, yes. JJ, definitely. A nurse is caring for 4 patients. Which patient should be evaluated first? Select all that apply. A patient with chest tube drainage of 250 ml bright red blood in 1 hour. A patient 24 post appendectomy with mild fever of 37.9. Okay. A patient with tracheostomy, copious thick secretion. A patient with DVT, complaining of chest pain. Okay. And a patient with anemia and hemoglobin 9 gram per dl. Okay, let's move on. You guys can put all your answer, what you think about all the option. Alfred ECD. Nice. Anyone else with multiple options? Pulmonary embolism. ADE. Yeah. Okay, let's move to question ACD. Yeah. ACDE. Okay. Yeah. Okay. Let's move to, we have A a lot, so definitely A is there. A patient with chest tube drainage of 250 ml bright red color in 1 hour. Guys, what it is indicating, especially when we are having bright red? What's going on there? What's going on there? And what is the expected drainage? Active bleeding? Definitely. And what is the expected drainage rate? So A, definitely we're gonna say yes. Yeah, but what is the expected drainage rate in 1 hour? 50 ml? Anyone else? Okay, anything above 100 ml is active hemorrhage. Okay, anything above 100 ml. Yes, yeah, yeah, Kendra, less than 100 is okay. Okay, anything above 100 is active hemorrhage. And if something is like, if patient is draining, more than 100, especially in this case 250, so that is circulatory, affecting the circulation. And can patient go into shock? Yes, and we need to intervene immediately. Okay, a patient 24-hour post appendectomy with mild fever of 37.9 is be expected. Patient just had appendectomy and just having mild fever. What can happen when we have surgery? Is it body's normal response or abnormal? Yeah, expected. Yeah, yeah, definitely. And it is inflammatory response, so you can see fever and pain. And 37 point, is it life threatening? Is 37.9 is life threatening? Yeah, nah. No. So 37.9 is not life threatening. So we are not gonna worry about this one right now. Okay. It at least we need 24 to 48 hour after surgery, like just to settle it down and to see whether it's increasing or decreasing and how it's affecting. Yeah. Yeah. Okay. A patient with tracheostomy and copious thick secretion. What about C, guys? What about C, guys? A patient with, isn't B sign of infection? It is expected, Anjali. It is expected. Okay. Yeah. So we don't. Airway obstruction risk needs suctioning. Yes. That's the one, Alfred. That's the one. Okay. Now we have tracheostomy over there and copious thick secretion. What is happening? Respiratory distress, airway occlusion. So definitely it is A for airway, and then we need to suction it as soon as possible. What else we can do in this patient? What else we can do with this patient? How we can reduce the secretions? Positioning, head of bed, and what else? Needs suction, yes. And humidity, humidification. Okay, so that's how we can, but definitely because it's A, yes, humid oxygen, definitely. Okay, so A is priority, airway. C, yeah, saline, yeah, depend like how's the blood volume doing. So we can definitely give dash saline, but depending upon how circulatory vitals are doing. Yeah, humidifier fluid, mucolytics, जैसे ही बोले. Okay, a patient with DVT complaining of chest pain. What about this one, guys? What about this one? Guys, please join the team. If you haven't joined the team, please join the team. Okay. Okay, D. Yeah, DVT, pulmonary embolism. Yep. Life threatening. But it is affecting. Is it affecting airway? Is it affecting breathing or circulation? What it is affecting? Um, Actually, DVT is deep vein thrombosis. Okay, most of the time it happen when there is a clot, and then that clot can travel up and can cause pulmonary embolism. Okay, it is C, circulation, definitely, but it is B also, breathing, because it's gonna cause respiratory distress, and then later it will cause respiratory failure and maybe death. Okay, so D is important. So we are gonna say BC here. Okay, nice. A patient with anemia and hemoglobin 9 gram. What about that one, guys? Is it? Yeah, yeah. What about E, guys? Hitchhiking. Yes. So it is not life threatening anyway, and it is a chronic condition. If somebody is having anemia, it's not acute. Okay, and it is expected to have low level of hemoglobin. So firstly, we need to monitor the patient, and then we can find like if there is anything else we can do for the patient on that time. Yeah, they okay. Anemia, definitely they okay. Alrighty, so now we got patient number D with DVT, we got patient number C with tracheostomy, and we got patient number A with C, circulation chest tube drainage. What we can do? Who we gonna prefer, guys? Who we gonna prefer? Which one is our top priority? D. Yes. DAC. Okay. Patient is symptomatic. D. Okay. Come on, guys. Put the three option. Put the three option. I want you to put like A B C or D A C, C B A. We don't have B A. We don't have B. We only choosing from D, C, and A. J J D A C. Okay. Which one? Which one is easily? Which one is easily we can sort out? That doesn't gonna need time. CAD, yeah. DAC, C, yes. So C is the one actually you guys can sort out as soon as possible. Yeah, chest pain is definitely highest priority, but for chest pain also, what we can give nitroglycerin, we can, like pulmonary embolism. I know it's not myocardial infarction, I know, but you need to report, you need to ask for help, you need to see, you need to have anticoagulant sorted over there. Okay, A RN. Okay, so with A, normal expected drainage is 100 ml. Okay, and we are having chest tube drainage of 250 ml. So that is acute hemorrhage. Yeah. So yes, Ima. So we are gonna leave A to the last. Okay, we gonna leave A to the last. We will report because we don't want to touch the test tube, we don't want to do anything over there. Yeah, so now we only have patient number C and patient number D. Okay, yeah, and if we will choose from ABC, airway is always first. Okay, I know breathing and circulation can affect also, but if you're gonna compromise the airway, then it's gonna cause problem. Yes, CDA, CDA. You guys can, because you are not gonna get question like this over there. Okay, you don't need to choose three options. Okay, so you're gonna get only one option to choose which one you are gonna prioritize. Okay, this is just for our practice, like what we can do, how we can help, what is under our scope of product, practice. So that's why we just doing this practice. Otherwise, multiple choice question is very easy, and like we are live now from lot of time and we are just on question number 6. Yeah, so this is very important to rationalize like what we are saying and understand, please. In NCLEX also and in other exam, they will look after how you are prioritizing, whether you are using the ABC, whether you are using the Marslow, whether you are using the unstable, stable, acute, chronic. They will see, they will rationalize everything with those tools. Okay, so it's very important to see how we are prioritizing. Yeah, and maybe A is not gonna get too much time, so A is like easily intervene, and then we can move to patient number D, and A is just report. Cheeto King, actually, I was live on YouTube. We did maternal health, and that video is already posted. That video is already posted on YouTube. Or is it today one? Today we just came here. Okay, so this one is gonna go to YouTube. All the session we have done today, it will be uploaded to YouTube, because this 50 questions are very important. These 50 questions are very important, and it's best way to, oh sorry about that, this is best way to develop our critical thinking. So we're gonna do it in batch of 10. So we will do 10 question today, and then yeah, next time I have created a Telegram group. I'm usually gonna message in that one whenever we will come live. So that's why I shared on our story. So if anybody had Telegram, please join that one, and I will text every time in that one when we are getting live. Okay, let's move to question number 7, guys. Okay, the nurse is caring for patient in a telemetry units. Which patient need immediate intervention? Yeah, I haven't posted there today because like there is only three parties. There is only three people. So I was expecting a lot of people to join, but it's okay. Next time I will definitely put it there. Okay, the nurse is caring for patient in telemetry unit. Which patient need immediate interventions? Select all that apply. A patient with VTech. Oh, alrighty. A patient with VTech on monitor but awake and alert. A patient with third degree heart block and HR30. A patient with stable angina requesting nitroglycerine. A patient post cabbage with drainage of 80 ml per hour. And a patient post pacemaker insertion reporting hiccups. What we No, we are not forgetting you guys. I usually post the story. Okay, but I will tell you guys time today also when we are gonna be live tomorrow. We will be live around same time. This is going good. Okay, guys, let's move to question number 7. Okay, what about A? The patient is having VTech. Is VTech life threatening? Is VTech life threatening? He's awake, he's alert, but is VTech life threatening? Yes, yeah, because it can go to pulseless VTech, or it can go to AFib, like you guys are saying, or VFib, not AFib, VFib. Okay, so we definitely, yes, Jesse Bonnie, VFib. Okay, so definitely is correct. Okay, but we, and it can lead to cardiac arrest also. So this patient is definitely gonna, yeah, this patient is definitely gonna need help as soon as possible. What about B? A patient with third degree heart block and heart rate is 30. No relationship with P and QRS over there. Okay, electrical signal is not reaching the ventricles. Okay, what's happening over there? That can be expected, but block definitely. But do we need to intervene because heart rate is 30? Yes for B. Everyone happy with B? Yes. Okay, because this is compensating circulation, this is affecting circulation. Heart rate 30, nah, we need to do something. Okay, let's move to patient C and make sure these are immediate interventions. Alrighty, a patient with stable angina requesting nitroglycerin. What about C, guys? Can we leave it for a while? Yeah, we can come back to this patient later. Is it okay? It's stable. Yes, definitely. And it's not myocardial infarction. And it's not life threatening emergency right now. So we can, yeah, come back. Definitely. And patient post cabbage with drainage of 80 ml per hour. What about D? Do we need to worry about patient after coronary artery bypass grafting? What about D, guys? Expected? Yeah, it is normal. Yeah. What can be, what we need to be scared? Yes, given the last question, no. That's what I was saying. How much we need to be careful? More than 100. Yes, so this patient is okay, this patient is stable, expected. Okay, let's move to patient number E. A patient post pacemaker insertion reporting hiccups. Yes, Alfred, definitely monitor this one, but not life threatening. What about patient number E, guys? Post pacemaker with hiccups. Yes, what's going on there? It need to be turned down. Not good. Yeah. What is going on there, guys? What is going on there? Pericarditis. Yes. Yeah. Because what's happening? Pacemaker wire is irritating the diaphragm. Yes, Alfred. Pacemaker lead displacement stimulating diaphragm. Definitely, that's the correct one. Okay, so that's why we need to report. Okay, and it is urgent. It is dangerous signs, so it need immediate medical attention. Okay, so that's why we need to worry about C. Okay, now these three, which one is priority? I know everything is priority. Okay, so don't worry, we can send all these three patients together to required departments, but which one we are gonna sort? This is actually all three are complex. Okay, this all three are complex. Yeah, I will. In this one let's go BAC or BAE. Okay, BAE. Yeah, okay, let's go BAE because this one we don't have enough fluid in body. E is first due to pacemaker, but like I know, Alfred, we are just doing general, like what we can sort first. And with definitely pacemaker insertion, that patient is need to go to the department, so that we can easily sort out, we can easily report, patient can send to department. Yeah, and provider can look after that one, what they're gonna do, because they need to sort out. Yes, there is insufficient uh, output with VTech. Yeah, there is, but because the patient is awake, patient is alert, so I'm just saying, like, if patient is alert, we are not seeing any signs of low heart rate, hypotension, so that's why it's like, we can do B first and then A. What do you guys think? Yeah, because I'm just considering if patient is awake and alert. Yeah, 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 that's the one. That's the one, JJ. Because like there is not enough conduction going on. Okay, BAE for me too. And please, guys, you do your rational. You do your rational. Okay, because this is not. This is different kind of question. This I made really hard. So usually don't you don't have to choose all these patient and then prioritize accordingly. Okay, you will get very easy one. It will be very easy prioritization. Because somebody was telling me on the first live like, oh, these are very simple, and I was like, you need to wait for my other resources. We have lot of complex things going on. Okay, I want ice cream also. When we lobotomize, guys, anyone? And this is actually good. This is good practice, we got to defib. Yeah, we got to defib. Okay, we are gonna do is there more question? There is 50 question. Okay, there are 50 question. I was just start thinking, sorry, lost in thoughts. Okay, we are only gonna do 10 question today. Okay, then we will be back tomorrow again for next 10. And this whole live will be posted on YouTube, so make sure you guys go to YouTube and subscribe. Okay, the nurse is caring for post-op patient which require immediate actions. Select all that apply. JJ20, then I need water break. We can do 20, but I need water break then. A patient with abdominal surgery with evisceration, a patient with surgical drain producing serosanguineous fluid, a patient with sudden restlessness and chest pain after hip replacement, and a patient reporting pain 8 by 10 after gallbladder, and patient with new firm calf after knee replacement. Okay, question number 8. What you guys thought? ACE is yes, definitely ACE is correct answer, guys. We will leave B and D, but we will do rationalize how why we are gonna is in that order. Yes. Okay. A patient with abdominal surgery with evisceration. I haven't. D Krina is little bit fishy. Yeah. So we're gonna leave D right now. We're gonna leave D right now. Guys, please do double tap if you guys are free. A patient with abdominal surgery with evisceration. Okay, what about A? What's going on? What's going on with A, guys? Do we need to notify the surgeon immediately? Yes, definitely. Okay, we need to notify the surgeon immediately. Incision open, organ can come out, everything can come out, so we need to worry about this one. Okay, what about B? A patient with surgical drain producing serosanguineous fluid. Is B expected? Yeah, pinkish, watery. Yes, this is okay. Yeah, yeah. It is not a concern and is surgical drain expected color. Okay, so we are not worried about this one. A patient with sudden restlessness and chest pain after hip replacement. What about C, guys? And we just done that one before. We just done that one before. What's happening? It's not expected. It's not expected, John. We really don't want that one. What's happening with the patient? PE? Yes. Definitely PE, and we really don't want to see PE because it can cause life threatening conditions. Yeah, and again, it is affecting breathing, it is affecting circulation. Okay, yeah. Okay, a patient reporting pain 8 by 10 after gallbladder surgery. What about D, guys? It is just pain. Patient just have gallbladder surgery. Yeah, so it can be 10 out of 10 pain also. Yeah, yeah. Okay. A patient with new firm calf after knee replacement. What's going on here? Why we need to worry about E? Yes. DVT, yes, Chris, definitely. We are having blood clot. Okay. And then it can, and this is the reason, all these, especially surgery in the legs extremities can cause clot, and then this can also lead to sudden restless chest pain after hip replacement. Yeah, yeah. PE, yeah, definitely. Okay, now we got patient E and C. They are kind of same, but they are not same right now. And then we got patient A. Thank you guys for following. Thank you for following. Really appreciate. Who we gonna choose first? Is A priority in our list? Is A priority in our list? From out of three, is A priority? C is priority. Yeah, C is priority. Yes. Um. Okay. Who can go after C? We will look after C first. Who is next one? They need electrocute. Yeah. E. Yes, Krina. And then A. Yes, definitely. So C. Then we go to E, and then we go to A. Okay. So all those are good. Okay, and we can leave B and D, and we will just tell them that we can come back after we will sort these one. Alrighty, let's move to question number 9. I think it's only good good to do 10 question today, and I will post these one on YouTube, and then we will do 20 tomorrow. We will do definitely 20 tomorrow. Okay. So a nurse has 4 patient which need urgent evaluation. Okay, select all that apply. A patient with cirrhosis and hematemesis, a patient with ulcerative colitis and 10 loose stool today, a patient with Crohn's disease and mild abdominal pain, a patient with diverticulitis reporting shoulder pain and rigidity, a patient with GERD complaining heartburn after spicy food. Alrighty, B and D. Yeah, AD. Yes. Nice, nice. Cool. Good one, guys. Yes, A and D definitely. Okay, why we need to worry about vomiting blood? Why we need to worry about vomiting blood? What's happening over there? Bleeding? Yes. Varicose bleeding in esophagus? Yeah. Hypovolemic shock? Yes. Severe circulation problem. Okay. Yeah, upper GI bleed, fluid imbalance, everything is going over there. Okay, so we will put this as a C, and we will look after this patient. Okay, circulation definitely is gonna affect circulation. Okay, a patient with ulcerative colitis with 10 loose stool today. Is B is the issue? Is 10 loose stool, guys? What can happen? Dehydration, again, all the things, electrolyte imbalance, yeah, hypovolemia, yes. Okay, and it will goes into C also, circulation, yeah, metabolic acidosis. Can we put it as circulation? Yeah. Okay, a patient with Crohn disease and mild abdominal pain. Yeah, it is physical more Maslow. Yeah. Crohn disease, mild abdominal pain. Is it expected? Yeah. It is not life threatening, is mild, is expected. So we will leave C right now. Okay, mild is fine. Yeah. A patient with diverticulitis reporting shoulder pain and rigidity. What about D? What's happening? We have diverticulitis. Now patient is reporting shoulder pain and rigidity. What's happening over there? Possible abscess of perforation. Definitely, Bonnie. Definitely. That's the reason. That's the reason. Okay. That's why we have peritonitis. Okay. And when you have shoulder pain and rigidity, especially with patient with diverticulitis, it is classical sign. It is classical sign. Okay. It is perforated ball, Anjali. It is perforated ball. Okay. There is a perforation going on right now. So this one, what can happen? It can lead to sepsis. It can cause life threatening infection. So we need to see it. It can put patient in shock. Yeah. Septic shock. Yes. Yes. Okay. It is just infection, Anjali, accumulation of a lot of things over there. Volume. Yes, volume. Okay. A patient with GERD complaining of heartburn after eating spicy food. Is that normal? Yeah, it is not priority anyway. This is normal, so we are not gonna do that. Okay, now we have three patient. We have patient with cirrhosis and hematasis. We have ulcerative colitis and we have diverticulitis. Who we gonna see first? Who we think we can see first right now? D. Everyone happy with D? Yes. Yeah, we will definitely go first to D. Okay. Who we can see next? B or A? Is there anything we can do with A instantly? How we can do that? A labs? Yeah. Massive transfusion? Yes. Yeah. Or shall we see B first and then A? Or D, A, B? I'm a bit confused with A and B, so please do provide me rational also. Because in B we can do the fluid. Yeah. What else we can do? Yes. Yeah. So, yeah. So DBA. Okay. DABE. Okay. Yes. Yeah. If A is gonna die, what we gonna do? Because we need match, we need cross match, everything. We need to organize. Yeah. I know. Yeah. Is urgent potential. my god. Yeah. Okay. Yeah, so just sort out guys between B and A. Because here we are just thinking more about what we are gonna do also, more on our side rather than provider side. Uh DC fluid A. We DBA, yeah. Yeah. Is everyone happy with D and then give some fluid to B and then A? Or shall we is B can wait? Can B wait? Because B is just having loose stool. Yeah. A is blood, B is fluid. Yes, definitely. Okay, we are gonna go DAB. Okay, we're gonna go this. B can wait. Yeah. Alrighty. Yeah. Yeah. So DAB. Alrighty. Okay, we are gonna move to last question for today. And I will post this video on YouTube, our Nursingy channel. So please do search Nursingy and share with your friend. And please comment under the video what's your rationale if you think we need to do something in different way in these scenarios. Please do comment over there and let me know how we are doing. And it's good practice. Okay, the nurse is assessing post-op patient, which are highest priority. Select all that apply. So a patient with absent pedal pulse, after vascular surgery, a patient with JP drain with 30 milliliter per hour output, a patient with sudden onset confusion after hip surgery, a patient with blood pressure drop from 140 to 90/50, a patient with mild nausea after general anesthesia. For subscriber, we get two more questions. Oh, I can make that deal. I can do that deal. If you guys can make it 115, yeah, I can do two more. But it takes time. I know even it took us 2 hours to do 10 question. We learned a lot. We discussed a lot. We have done a lot today. It's good to rationalize and understand everything rather than rushing through things. So I think this is the best way to study. Okay. Okay, what we are gonna do guys, what we are gonna do, ACD. Okay, there is lot of ACDs there. What we gonna do? Good one, Alfred. ACE. Alrighty. Anyone else before we will start rationalizing last option? ACD. Yes, Saran. Yeah. ACD. Okay. Okay, most of ACD, all you guys are good. Okay, a patient with absent pedal pulse after vascular surgery. What's going on here? A no good, D no good. Yeah. Um, when we lose pedal pulse, what happening? What happen over there? When we have no pedal pulse, no circulation, no perfusion. Yes. And after vascular surgery, what can happen? Why there is no circulation right now? Compromising circulating. Yeah. Yeah. Clot. Yes. Yes, definitely. So we got blood clot over there. Okay, so this is our first priority. Alrighty, no blood flow. This is severe circulation concern. So we need surgical ambulance emergency intervention. Otherwise, what can happen if we will not intervene? Yes, ischemic risk of limb loss. Yes, I was just going to ask that question, Alfred. Thank you for answering. Okay, because if there is no blood supply and we are not intervening on time, then the problem gonna happen is we are gonna lose the limb. Okay, a patient with JP drain with 30 ml output. What about B, guys? Jackson Pratt drain. Is it normal? Expected? Yes. JJ, we need 5 now. Somebody unsubscribe, so it's okay. Yes, so this is expected. Okay, this is expected. Alrighty, so B we don't need to worry about. Yeah. Uh, a patient with sudden onset confusion after hip surgery. What about C, guys? What about C? We already done that. Confusion post anesthesia. I don't think so. Because I don't want to consider anesthesia right now here. Um, what can be the other reason of onset of confusion after hip surgery, or what can be the other reason? We know we done DVT. We know when we done DVT. What can be the other thing similar to DVT that can cause confusion, guys? We can't treat that. We need only fat embolism. Just Nikki, definitely. Okay, so we are getting fat embolism here. Okay, main concern is fat embolism. Okay, what else can happen? What else can cause confusion after hip surgery? Is hip surgery massive surgery or easy surgery? Can patient lose too much blood over there or not? Yeah, fat out air delirium. Yeah, yes, invasive. Yes, definitely. Okay, so fat embolism is main concern for us, but hypoxia can happen, stroke can happen, infection can happen, hypovolemia can happen, everything can happen. Okay, and all of those can cause confusion. Our most concerning part is fat embolism. Okay, yeah, even sepsis. Yeah. Okay, so C is our neurological concern, highest priority right now. Alrighty, a patient with blood pressure drop from 140 to 90. What's going on? 140, 80 to 90, 50. What it can indicate? What can be cause? It can be cause of hemorrhage, definitely. What else? What else can be the reason behind that? Shock, medication, hypotension, electrolyte shift. Yeah. So all sorts of, and this is very serious C, life threatening C. Alrighty. Option number E. A patient with mild nausea after general anesthesia. Is it expected? Is it expected? E, they all right. Yeah. Yeah. Nothing gonna happen there. Give them some ondansetron and all good. Okay. Alrighty. So now we have three patients. Now we have A with absent pedal pulse. Now we have C with sudden onset confusion after hip surgery, and now we have D. Which one you gonna see first and which one you can intervene first? That's under your scope of practice. Um, D first? Yes, definitely D first. Okay, someone else unsubscribed us on YouTube, so thank you guys. Okay, D first. What we can see, A or C now? Who we gonna see first? DCA. Um, what we can do for C actually, if it's depend upon the condition, definitely we can do. Should the answer be in order of priority? Well, we are just trying. We are just trying. This is just question I created, so I made it very complex so we can actually do lot of rationalization and we don't need to jump to too many. But this is just we are doing for practice, like what we gonna see first. Okay, this doesn't need to be in priority order, especially in the exam. You only need to choose one. Which one you gonna choose? JJ is okay. It's okay. We can do tomorrow more. Promise. We can do 20 question tomorrow. Okay. Can we do C or A? Lot of factor to rule out on C. Yes, that's what I'm saying. That's what I'm thinking. Because if it is fat embolism, if it is only fat embolism, what you can do for fat embolism? What you guys can do for fat embolism? Alfred, I will give you the time right now. Just hold on. What we can do for fat embolism? Can we give any anticoagulant or can we do any other therapy? What we can do? Yeah, brain is time, but we can do what we can do. Surgery. Yeah, actually, we honestly with fat embolism we can't do anything. If this patient is having confusion about for stroke, for losing too much blood, then it will be our priority, same as D, you know, fluid, oxygen, and everything. So here in our scope of practice, C is just we need to inform, we need to communicate, we need to monitor patient's vital. Yeah, and if they giving us fluid, then we will do that. A, there are chances that we can still intervene early. Okay,